I'm I practice. I'm a practicing psychologist, so I'm affiliated to various centers as a psychologist, and I also do my private practice as a behavior technician. Yeah, so I'm a graduate of PLM ng undergrad, graduate of UST ng clinical psychology. Ayun, so that's me, and I hope we will have a fruitful afternoon ngayon. Should I go ano na po, straight on, no? Wait lang, may mga pumapasok. Share screen. So throughout the ratio, you can ask question. Maybe I'll ask questions then, if ever. And then you can just unmute and, answer the question. Rationalize, let's help each other rationalize the questions. Presenter. Ayan. Kita niyo yung screen?
Yes po.
Yes. Opo.
Ano nga ba i-ano? Hindi na ako sanay mag-zoom kasi face-to-face na ang klase. Speaker, yeah. Okay, so for today, we're going to rationalize the abnormal psychology. I made 2 exams. The other one is the advanced abnormal psychology. I think both nyo siyang nasagot. Pero for today, we're just gonna rationalize the abnormal psychology diagnostic exam. So there are 100 items and hopefully matapos natin siya today. Okay, so sige, start na tayo agad. So I believe you are all aware of the TOS naman ng abnormal psychology. So part of that mostly is diagnosis ng mga disorders yung tinatanong kapag sa RPM level. Pero it also good na alam nyo yung mga etiology or perspective of different psychopathology. Okay, so number 1, which of the following is a characteristic of abnormal behavior? The famous 4Ds, dangerousness, deviant, distress. There's one more. So definitely all of the above can be a characteristic of abnormal behavior. What's the kulang? Anyone who knows or would like to answer? Ano yung isang D of abnormal behavior?
Dysfunction.
Okay. So,
Danger po.
okay, danger is here, deviant is here, distress. Narinig
Dysfunction.
said dysfunction. So yun. But you have to note na not all 4D should be present in an abnormal behavior because may mga sakit sa DSM na walang distress, may sakit na walang dysfunction. So hindi siya necessary na kompleto yung 4 para ma-consider na abnormal yung behavior. These are just the things that we look for para mag-categorize. Okay, second. Of the following, whose behavior would be considered abnormal? Okay, so the answer here is letter A, a security guard who believes everyone is out to harm him. Bakit? Kasi because of his job, the nature of his job, security guard siya. And if he is a security guard tapos meron siyang paranoid delusions, let's say, that everyone is out to harm him. So most likely magkakaroon ng dysfunction. And merong distress definitely if iisipin niya na lahat ay nandyan para saktan siya. So yung letter C, bodybuilder who bulks up with special diet and exercises is usual. Sexual promiscuous teen whose culture, that should be whose, encourages sexual encounters. So you always have to consider the cultural background. And then eccentric genius with an IQ of 200. The person is eccentric and then it is parang expected na meron siyang high IQ. So it's just usual or normal. Answer here is A. Number 3, which of the following is not a category of the biological view of psych disorders? So this is just conceptual. Based on the based on the construction of the choices. Yung letter B lang yung hindi nagko-communicate ng bio. So sometimes siguro test taking skill kahit hindi nyo alam yung mga concept or something, parang di kayo sure, 'di ba? If you have good test taking skill or you know how to do the process of elimination and so on. So madali naman siyang, best answer yung masasagot niya. If not, if hindi kayo sure. Fourth, Marian will do anything to promote herself, even if it's taking advantage of others. More so, she feels no remorse when she hurts others and seems to have no conscience. How would a behavioral therapist explain this? Okay, so merong iba't ibang major perspective sa psychology. So isa dyan yung behavior perspective. Ano pa yung iba nyong alam na na perspective sa psych in explaining disorders? Anyone? Aside from the behavior perspective.
Psychodynamic po and humanistic.
Okay, psychodynamic, humanistic, behavior. One more. Pinakasikat aside from the psychiatry.
Possible po ba yung traits perspective?
Okay, trait perspective. Although nakatreat more of the personality tests and so on, yung mga statistical techniques. One more.
Cognitive.
It's the cognitive perspective. So kapag ganyan, yung mga perspective na you should have a clue word per, biological is also a perspective. Clue word per perspective para makita nyo lang yun, matik yun yung sagot. So when we talk of behavior theories, ang sagot dyan, ito ang naka-highlight, rewards and punishment have shaped behavior. So this is operant conditioning. So kapag behavior perspective, pag nabasa nyo yung learning, rewards, punishment, conditioning, stimuli, response, so that would be behavior perspective. Yung letter A, since neurological imbalance, definitely it's biological perspective. Letter B, unconscious conflicts that result from ineffective early relationship with parents have influenced her behavior. Which perspective yung letter B?
Psychoanalytic po.
Psychoanalytic because of the term unconscious conflicts. And letter C, it is her effort towards self-actualization that manifests this outcome. So this is definitely humanistic because the clue word would be self-actualization. So may mga question na ganyan na pinapa-explain from which perspective. Number 5, Gabby experienced a non-rewarding childhood. Her mother physically and verbally abused her while her father sexually abused her. Years later, she began experiencing anxiety symptoms related to her childhood experiences. Which of the following disorders would best apply to her situation? So the answer is PTSD. From the question, alin dyan yung clue that would tell us that it is PTSD? Anyone?
Ano po, past experience of trauma, tapos minimum dun sa sa number of sa kung gaano katagal yung manifestation. So nag-exceed na siya sa I believe 3 months, so pwede na yata sa PTSD. Tapos yung anxiety and anxiety symptoms related to the past experiences of trauma.
Okay, good. So yung pinaka-clue natin dyan, yung anxiety ay related sa childhood experience. If the anxiety is free-floating lang, that would be GAD. Kung hindi mention yung childhood experiences. So yeah, pay attention to the clue words. And then I think, I believe PTSD 1 month na symptoms. Pero ito may delayed expression kasi years later niya pa na-experience yung symptoms. Next, psychological disorders that involve a sudden loss of memory or a change in identity are called So definitely it's dissociative disorders, dissociative amnesia, DID, change in identity. Next, what is the relationship between negative schema and depression? So answer is letter D. Depressed individuals engage in habitual negative thought patterns. Negative schemas do not interfere with depression, but more likely it causes the depression. Depression limits negative schema, no. It's mas na-heightened siya with depression. Depressed individuals process information more inefficiently. That may be true, but then schema, if magpo-focus tayo sa question, schema doesn't really refer to the process, but schema is more of our interpretation of the world. So yeah, so this is the cognitive perspective of depression. Next, a movie character portraying as schizophrenic consistently interacted with other characters who were only figments of his imagination. As real as they seemed, these imaginary characters were only, answer is letter C, hallucination. So what is the difference between hallucinations and delusions? Anyone? Anong difference ng hallucination sa delusion na alam niyo?
Ano po, hallucination includes seeing, hearing, tasting, smelling, or feeling something that isn't there. And in the other hand po, delusion are false beliefs despite evidence of the contrary.
Okay. So, tama yun. In other words, hallucination without external stimuli, pero meron kang nasa-sense. Delusion with external stimuli, sabi mo nga, despite the evidence na that contradict yung belief. So, with external stimuli, pero iba yung interpretation nila. So, that's the difference, yung presence and absence of a stimuli. So, this one, it is hallucination because our clue word here is, ano yung clue word? That's a hallucination. Okay, the clue word here is imagination. So meaning, there's no external stimuli, it's all in the head na ini-imagine niya lang yung figments ng characters na yun. So hallucination is the answer. Next, James, age 16, was caught again trying to pawn some of his parents' antique jewelry. He has skipped so much school that he will have to repeat his courses. He is also unconcerned that he has gotten 2 different girls pregnant in the past year. He would probably diagnose as having a or an answer is ASPD. So conduct disorder in ASPD actually has the same symptoms. Ano yung difference nilang dalawa ng conduct tsaka ASPD? Anyone knows? What's the differential diagnosis?
Hello po. Actually, may question po ako dyan sa tanong na yan. Kasi po yung pagkakaiba po ng ASPD sa conduct disorder ay sa age po. Di po natin pwedeng i-diagnose ng ASPD yung isang tao if hindi pa po siya 18 years old according to DSM-5. Kaya po yung sagot ko dyan ay conduct disorder kasi lower 16 po yung sinabing age. So, ang possible po na diagnosis sa kanya ay conduct disorder lang. Unless po na pag nag-18 na siya, pwede na po siyang diagnose ng ASPD po o antisocial personality disorder.
Okay, I have to check pero as far as I know, ASPD is at least 16 years old. Hindi siya 18. So at least 16, 15 pababa ang conduct disorder pero tapos dapat lumabas ma-diagnose 13 between 13 to 15. Tapos pag nag-16 siya, it should be ASPD. Pwede natin check sa DSM-5. Wait lang, try natin. Pero yeah, as far as I know, it should be 16 years old, not 18. Siguro 18 kasi tingin mo personality disorder. So dapat 18 na mag-solid siya. DSM-5. And another diagnosis ng ASPD, dapat may prerequisite na nag-conduct. Personality. Ito. Paano ko ba ulit share? This is DSM-5. At least age 15 years yung diagnosis ng ASPD. So 16 na siya, so definitely magpo-fall na siya under ASPD. Mag-present. Ayan. And then dapat meron siyang ano yun? Prerequisite na conduct. Dito ako sa mag-share. Okay. Criteria B. Ano yan natin? Oh, the individual is at least 18 years. Okay, sige. I stand corrected. So, dapat conduct muna siya. Saan yung share? Oh, ang inaano ko is the evidence of onset between before age 15 years. May prerequisite siya and then dapat 18 years siya at least. Okay. So it should be this one. Thank you for that. Letter A, conduct disorder. There. Okay, next. A woman wandered away from her hometown and was discovered under a different name and identity 5 years later in a distant city. She's most likely suffering from a fugue state, which is now specifier na lang ng depersonalization, and then hindi na siya different diagnosis. 11. So this one is just conceptual. Until the 1970s, hysterical disorders were diagnosed only in women. In fact, the term hysteria derives from the Greek hysteron, which means uterus. So yung may maraming gantong question sa boards, yung historical sense, yung nasa chapter 1. So sometimes, like for example, for the RPsy, nitong last, it's more of TOP than abnormal psychology na yung exam, parang ganun, na puro theories, puro history yung tinatanong instead na diagnosis. So pay attention din dyan, wag puro DSM, puro may mag-aral din ng chapter 1 ng mga libro kasi that's important. Number 12, in the late 1800s, the emphasis on a biological cause of mental disorder resulted ironically in reduced interest in treatments for mental patients because it was thought that, letter D, mental illness was due to an undiscovered brain pathology and was incurable. So dumating na sila sa point na helpless yung mga tao because of the belief din, yung lunatic belief, and so on and so mga ganong theories, mga ganong concepts na nag-occur during the earlier stages ng psychopathology. 13. In using hypnosis to treat patients with psychological disorders, Freud discovered na yes, therapeutic to recall and relieve emotionally traumatic events. Kasi yan din yung way niya para maipalabas ng conscious. So, syempre, aware naman siguro tayo lahat na ang goal ng psychoanalytic is to make the unconscious conscious. And one way to do that is to relieve yung emotionally traumatic events and see kung ano yung responses, current responses ng tao. Number 14, most psychological disorders appear to be influenced by many individual genes rather than caused by one single gene, a process referred to as polygenic. So yung multigenic, I think inimbento ko lang. Pero yeah, polygenic is the answer. This is again a conceptual question, a recall item na yeah, need lang i-memorize. So polygenic is the correct answer. 15, according to the diathesis stress model, psychopathology is the result of, it should be an interaction of inherited tendency and events in a person's life. So diathesis, mag-interact, hindi pwedeng, it explains yung predisposition natin in developing a disorder. So if yung parents mo merong mental disorder, tapos for example, you have to be triggered by your environment para mag-develop ng disorder according sa diathesis stress model. So without a stressful event, most likely hindi ka mag-develop based on this model. According to the diathesis stress model, monozygotic twins raised in the same household will, letter C, not necessarily have the same disorders because of potential differences in their stress. So sa diathesis, is like the biopsychosocial, may biological predisposition, social predisposition, sabihin natin pareho sila, since pareho sila ng kinalakihan na bahay. Sabihin natin same stress sa bahay. But then the psychological predisposition might be different because they are two different people. They process information differently. Kaya not necessary na pag meron yung isa, meron din yung kakambal niya, because of individual differences. And they should all interact, those factors, para maka-develop ng disorder. Seventeen, John has inherited a personality trait that makes him more likely to keep to himself than to socialize. As a result, he does not have many friends and spends a lot of time alone. If John were to develop depression, the model that would probably best explain this situation and the cause of his depression is letter C, reciprocal gene environment. So meron siyang gene or an inherited personality trait, and ayon ay nag-cause para mawalan siya ng friends and spends a lot of time. Hindi siya magiging diathesis kasi dapat hindi siya, etong as a result, hindi dapat siya, not necessarily connected siya dun sa biological makeup. It can be a separate traumatic event or negative event from the environment that will interact sa biology. So sa reciprocal gene environment, yung inherited vulnerability natin and stressful condition produce disorder because we are the one creating the environmental risk. So dahil meron siya nun, hindi siya extrovert, hindi siya outgoing na tao. So parang because of that gene environment interaction, nag-result yung disorder rather than a separate, a completely different negative event interacting with our biological predisposition na dinidiscuss ng diathesis. If you have questions in between, just feel free to interrupt. 18, the conditions that are now called neurocognitive disorders typically cause impairment in all of the following primary abilities except, so dreaming, definitely. Nasa DSM naman yan, na may impairment sa memory, perception, and attention kapag sa mga neurocognitive disorders. Dreaming yung hindi nabanggit. Next. 19. Impaired consciousness and cognition during the course of several hours or days defines delirium. So nandyan yung disoriented, so hindi ka conscious, hindi ka well aware sa environment mo, may impairment din sa memory, and so on. So delirium is the answer. Ito, si Mr. Cruz, age 72, is brought to the hospital emergency room. His son explains that his father woke up this morning and was not himself. Mr. Cruz appears confused, agitated, and a bit frightened. He does not know his own name and cannot recognize his son. Mr. Cruz's son reports that his father has been completely fine with no symptoms prior to that morning. Mr. Cruz appears to be suffering from also delirium. Ang clue words natin dyan ay yung not himself, agitated siya, confused, and frightened. So may disorientation na nangyayari. So not Lewy bodies or Alzheimer's because hindi binanggit yung cause. Parang 'di ba sa neurocognitive there should be may presence of the causative agent ng mga diseases na yan, and not amnestic disorder because of the nature of the symptom na confusion, agitation, not necessary na meron siyang memory loss na nangyari during the episode. Ayun. 21. At the age of 50, Mitch has begun to receive quite a bit of teasing from her family about being absent-minded. The truth is that Mitch has been hiding the fact that each week she seems to remember less and less. For the last month, she has been getting lost while driving home from work. Lately, Mitch has been relying on hand-drawn map to get home. She started having trouble recognizing faces of people at work and frequently forgets why she started to do something. Mitch appears to be developing. Answer is neurocognitive disorder. Specifically, it would be Alzheimer because of the symptoms na pinapakita niya. So hindi naman amnesia kasi nakaka-recover siya from the memory. Ito nga ba yun? Yeah. So may mga lapses na sa memory niya na characteristic ng Alzheimer's disease, probably early onset since 50 years old pa lang siya. Not delirium because hindi naman disorientation, confusion, yung symptoms na pinapakita ni Mitch. Okay. Next, the inability to recognize objects is called, the answer is agnosia. So meron, di ba alam niyo yung typical signs and symptoms ni Sadok and Kaplan and Sadok. So ano niyo yan, basahin niyo kasi may mga tinatanong lang na terminologies for that. Although super dami nun, just familiarize yourselves doon sa mga term na typical signs and symptoms kasi mahalaga din siya. Dapat alam niyo yung definition na lang naman pero kung saang mga disorder siya nakikita. So usually anhedonia is depression. Apraxia is the inability to plan the motor movement. Let's say sa mga neurocognitive na hindi na nila mabihisan yung sarili nila. Pwedeng may apraxia. Alexia is the inability to see words or read caused by the defect of the brain. So it can also be during a neurocognitive disorder. Okay, the physical symptoms of a major depressive disorder include, answer letter A, changes in appetite or weight. Letter B is a cognitive symptom and increased energy, more of behavioral. Decreased self-esteem, the psychological symptom ng pwede ring behavioral because of the perception ng self-esteem or self-worth. So physical symptom is the appetite or weight. Either super kain or walang gana kumain. Extremes. When used in connection with mood disorders, flight of ideas means letter B, rapid speech expressing many exciting ideas at once. And usually sa mood disorder, saan natin siya nakikita? In which episode? Yung flight of ideas is a symptom of Okay, flight of ideas is a symptom of a manic episode. So yung jumpy sila pabago-bago ng sinasabi or many topics in one conversation. Here, a 35-year-old individual named Manny has recently formulated an elaborate plan to cure AIDS with vitamin therapy. To provide funding for this cause, he has withdrawn all the money from his bank account and purchased thousands of jars of vitamins and small boxes in which to put, oh no, may kulang sa sentence. Anyways, so when he appeared at a hospital emergency room, loudly demanding names of patients with AIDS, he himself was hospitalized for psychiatric observation. What can be Manny's diagnosis? The answer there is manic episode. The main difference ng manic at saka hypomanic is yung duration. Hypomanic is 4 days, manic is 7 days a week. Pero hindi naman siya sinabi kung ilan yung duration. Ang pinaka-clue natin, bakit manic? Because he needed hospitalization. So, I believe nasa DSM yan na if require yung hospitalization, magiging bipolar 1. And ang required sa bipolar 1 is just a manic episode. Bipolar 2 should be hypomanic plus depression. So sa bipolar 1, manic lang. Kung may depression, bonus. Pero if manic lang, should be the type 1. And our clue there is he was needed to be hospitalized for observation. Next, PDD, persistent depressive disorder, differs from MDD because people diagnosed with PDD have symptoms of depression that are, letter B, longer lasting. Ilan ang duration ng PDD? Gaano katagal? Anong duration ng PDD?
2 years po.
2 years po. Chat pala kayo, hindi ko nakikita. Sige, open ko. Okay, anyway. Yan, so 2 years MDD, 2 weeks. So longer lasting siya, mas chronic. Next, Jack experiences recurrent episodes of MDD, major depressive episodes. In the intervals between episodes, he does not seem to return to normal. In fact, during those periods, he has been diagnosed as suffering from PDD. So Jack's condition is referred to as double depression because of the presence of both PDD and MDD. Next, at various times, Nancy, a 20-year-old college student, has been considered by her family and or friends to be moody, high-strung, explosive, or hyperactive. She never fails to take care of her responsibilities, but the fact that she seemed to experience mood swings that are outside the norm has been noticed by those around her. What is Nancy's possible diagnosis? So sa base sa choices naman, it's only the cyclothymic disorder na may manic symptoms out of the 4, and yung dinedescribe high-strung, explosive, hyperactive can be symptomatic of manic. So it's the cyclothymic disorder na sagot dito. Next, a friend of yours tells you that he thinks he is mildly depressed but is not sure. Knowing that you are studying RPsy, he asks if there is any kind of laboratory test that could determine whether or not someone is depressed. You respond correctly with one of the following statements. So more of ethical thing. So the answer is letter C. Currently, there is no way of diagnosing depression with a laboratory test. So if you're not sure, never promise them na may mga lab tests that can diagnose or cure yung mga disorders natin sa DSM. So letter D definitely falls dahil increase yung cortisol. Dexamethasone suppression test, I believe, is for the bipolar disorders rather than sa depression, rather than sa unipolar depression. Martin Seligman's theory that people become anxious and depressed because they believe that they have no control over the stress in their lives is called, so letter A, the learned helplessness theory. cognitive behavioral, CBT would be kay Beck. Humanistic existential, sila Maslow, sila Rogers, the existentialist, mga ano na tayo, contemporary psychology and control theory of depression. I think ginawa ko lang. So yun. So learned helplessness theory kay Martin Seligman. That's why people are suiciding, because they have tried everything and the suicide is the only solution, or left their no choice but to suicide because they're already helpless after trying several methods to get by. The characteristic features of personality disorders tend to develop with, so answer is letter C, a chronic pattern with onset in childhood. So childhood pa lang nakikitaan na. Tulad nga ng sa ASPD na bata pa lang meron ng hints ng conduct. And then chronic pattern meaning persistent siya, long-lasting. So once na-diagnose, diba, since it's also a personality character issue, so it will be with the individual ng matagal. So ito sa chronic pattern. Next, which set of adjective pairs correctly describes the clusters into which DSM-5 personality disorders are grouped? So this one, if alam nyo siya, so you can differentiate na cluster A to cluster C. So the answer is D. Odd eccentric is the cluster A, mga schizoid, schizotypal. Cluster B, dramatic, emotional, histrionic, borderline, etc. And then anxious and fearful, nandyan yung dependent, avoidant, OCPD, yun. So if you know these adjectives, it would be easier for us to differentially diagnose among the personality disorders. Next, both John and Fred meet the diagnostic criteria for paranoid PD. John's friends are aware of his paranoia, although he continues to live a meaningful life. Fred's paranoia is so extreme that he finds it hard to function in society. The DSM-5 diagnosis for these individuals would be exactly the same. Sinabi naman na rin sa question, they meet both the diagnostic criteria for paranoid PD. The thing with personality disorder, sometimes walang distress and most of them ay functional in the society. So walang distress dahil, for example, NARC or ASPD would not go to therapy because none of them would admit na may mali sa kanila. So paranoid personality disorder as opposed to delusional, paranoid delusions na meron lang theme, may specific, or hindi siya characterological nature ng tao. As opposed sa paranoid PD na parte na ng personality nila, ng character nila. So they get to function still, parang they get to live with it despite the ideations na meron sila sa kanilang isip. So ito yung mga classic example na the 4Ds doesn't have to be present para lang i-consider na abnormal yung behavior. 34. An individual presents for treatment and keep talking about how gangsters are out to get him. Before diagnosing paranoid PD, we must determine whether definitely A, his fears are justified. Baka kailangan muna mag-history taking, baka itong tao na to ay may utang sa mga gangster. So for example, ngayon nauuso yung mga kidnapan. So if a person ay may startled response kapag nahintuan sila ng white van, we wouldn't say na paranoid sila or panig because their fears are justified because of the recent news. So clinical judgment, part of it is good history taking skills para ma-rule out yung mga cultural, social factors that lead to the diagnosis. 35. An individual who gets through life as a loner with no motivation to interact with others, but with relatively normal behavior and beliefs is likely to be diagnosed with schizoid. So ang pinaka-highlight ng schizoid is hindi nila trip, makipagkaibigan, okay na sila po sa kaibigan nila, yun lang. So withdrawn talaga sila, but then their behaviors and beliefs are okay. They just, hindi dahil sa walang energy, pero that's just they want, ayun yung gusto lang nila talaga sa buhay nila, na maging withdrawn from other people. Na even family members, they would have a hard time establishing relationship. So histrionic naman, gusto nila marami because they need to be the center of attention. Narcissistic, they would partner to a person with equal status. Tingin nila equal status nila. And paranoid PD, they would have a hard time establishing relationship because of their paranoia. But they want. Pero may relationship. Schizoid, zero, talaga. Parang one to none relationships ang meron sila. 36, individuals who are socially isolated behave in ways that seem unusual, tend to be suspicious, and have odd beliefs are generally diagnosed with schizotypal. So the difference, pareho silang withdrawn ng schizoid, but ang clue natin dito, odd beliefs. May magical thinking na present sa schizotypal. I had a client before with schizotypal na previously nurse siya. She used to work as a nurse. Pero yan, mayroon na siyang magical thinking na feeling niya, tingin niya, yung pinakain sa kanya ng kapitbahay ng Indian, as in minimension niya yung race, is may black magic. Ganyan. Kaya daw siya naging ganun and all that. So mga ganun sila mag-isip, and then yung itsura is very eccentric, yung the way nila i-present yung sarili nila. And they would isolate themselves as well, katulad ng schizoid. Pero sa schizoid, okay lang yung beliefs. Ito ay may magical thinking. 37, which of the following is not true about those with ASPD? So we have a negation word, which is not. So we are looking for a false statement. So ako, ang technique ko sa test taking, kapag may mga except, kapag may mga not, na ganyan, lalo na pag everything, all of the following are not, blah, blah, except, so double negative. I would have to translate it in my mind kung ano yung hinahanap ko. Imbes na mag-focus ako sa not true, kasi nga negation word siya. I-turn ko siya into positive. So, just false. I'm just looking for the false statement. So, the false statement here ay letter D. They cannot avoid brushes with the law or learn to function well in the society. They can, actually, and they can avoid yung sa law because part of the symptomatic din yan is paano ka hindi mauhuli with what you're doing. Yeah, so based on research, kapag lower yung IQ, predictive ng run-ins with the law, and then some function quite well in fields such as entertainment and politics. I think may mga news naman about that. And they tend to come from families with a history of criminal problems. So that would be the diathesis for that, their predisposition to developing the ASP. 38. Rob is a 15-year-old boy who has been repeatedly arrested for theft and assault. In addition to shoplifting, he has been caught stealing money from his parents' wallets and his younger sister's piggy bank. Rob show no guilt or remorse for the many ways that he hurts others. So his diagnosis is conduct because of the age, tapos no remorse, no guilt or remorse kahit na ito na yung mga ginawa niya. Next. All of the following are common disorders that tend to be comorbid with borderline PD, except the answer is OCD. So people with borderline PD, nandiyan yung instability ng self-image, merong suicidal, manipulative. Kung sa layman's term, they would be manipulative, mababa yung self-worth din nila, which is part din ng depression. Suicidal is also part of the depression. Bulimia nervosa, eating disorder, kasi because of the instability of self-image, it might be a comorbid na may eating disorder. Then substance abuse, part ng pagiging impulsive nila. Kaya nagiging comorbid sa substance abuse. So OCD is the least likely na maging comorbid ng people with borderline. One of the influences associated with the development of borderline personality disorder is, so answer is B, history of child abuse or neglect. So usually may yung mga taong nagde-develop ng borderline PD, meron silang trauma in the past na na-experience. Meron din akong client before na may borderline pero hindi inflicted, hindi ano lang, paano bang abuse yung na-experience niya. It's more of matanda na siya, mga ano na, pero ngayon lang lumalabas yung ano, yung characteristics. Pero ang hinihiling niya sa parents niya is yung love. Parang kulang siya sa love in a sense. It's more of parang pinapamukha lang ng magulang niya na pinrovide na nga namin lahat ng needs mo, pati pa ba yung emotional needs. Parang ganun yung dating. So, since syempre iba-iba tayo mag-process ng information, so siya, na consider niya yun as neglect, emotional neglect. So ngayon, she's having a hard time dealing with her relationship, tas maraming self-mutilating behavior na consistent sa symptom ng borderline personality disorder. So yun. Next, the chief motivating factor in both anorexia and bulimia nervosa is letter C, an overwhelming urge to be thin. So desire to purge is sa bulimia nervosa. Overwhelming drive to eat is the binge eating disorder. A desire to starve oneself is more of sa anorexia nervosa lang. Both anorexia and bulimia, they have the cognitive perception or process na I would do this para pumayat. Iba lang sila ng way. Sa anorexia, hindi talaga kakain, magsa-starve. Sa bulimia, they would eat pero make sure na ilalabas nila para masatisfy sila na kumain ako pero nilabas ko naman, so papayat pa rin ako. Ganyan. And based on research, another differential diagnosis nila, anorexia would have an underweight weight and then bulimia normal yung weight nila. Pero most likely may nagkakasakit sila sa acid sa esophagus tract nila because of paulit-ulit na pagpa-purge or pagsuka. Next, the strongest contributions to etiology of eating disorders seem to be, so answer, letter D, sociocultural. So yan yung mga classic example na kapag model, mga stereotypes sa babae na dapat mapayat, dapat ganito and ganyan. So yun yung nagpe-pressure sa mga tao with these eating disorders na ituloy yung kanilang way of eating because of the social pressure, cultural pressure na meron sila. Meron sa environment. Okay, next. Which of the following diagnoses would require the noticeable loss of weight? So sabi ko nga kanina, people with anorexia, underweight sila usually. So that would be the answer, anorexia. Binge eating, usually nag-overweight sila because dito walang purging. Sa binge eating, excessive eating na hindi normal in a period of time. Or parang more than the usual talaga na mako-consume ng isang tao during lunch or during dinner or something. Body dysmorphic disorder, ang kanyang differential diagnosis sa eating disorders is this is encompassing. Pwedeng hindi lang sa weight, pero yung itsura ng facial features mo, ng kamay mo, ng legs mo, all that. As opposed sa mga eating disorders na nakafocus sa weight, yung motivation, kaya hindi kumakain or kaya nagpe-purge or something. Next. Which of the teenage girls described below is at greatest risk for developing an eating disorder? So, si letter A, si Alice, who is currently on a diet, and her friends also diet aggressively. So that would be the social component of the development of disorder. Sa letter B, Sue is of average to slightly above average weight but wants to lose a few pounds. That's usual. Above average yung weight niya, few pounds lang naman yung gusto niyang i-lose. So it's not pathological. Megan's friends are concerned about the weight she has lost since she began working out with the swim team. So dito kasi medyo ko lang na information like ano ba yung requirement for the swim team na weight or body build, baka may ina-achieve si Mega na ganun. And then letter D, Jean has always been fairly thin despite the fact that she eats quite normally. So normal, body build lang, yung mga mesomorph, ectomorph, yung mga ganun na body types. Body type yung iba lang sa kanya pero normal naman siya kumain. So si Alice na reinforced or rewarded by her environment would more likely develop an eating disorder. Okay, next. Which of the following statements is true about individuals with an eating disorder? The answer is all of these statements tend to be accurate. So people with eating disorder have diminished sense of personal control as in the binge eating disorder. May manifest strikingly low self-esteem, kaya nga sila nagko-compensate, kaya hindi sila kumakain. And they display more perfectionistic attitudes in conjunction to the stereotype na meron sa society, in conjunction sa standard na meron sa society. So they tend to develop a perfectionistic attitudes about their physical build. Okay, next. An important aspect of the cognitive behavioral approach to the treatment of bulimia nervosa involves changing patients' dysfunctional thoughts regarding their weight and previous weight control strategy. So ito yung mga clue words na naman. So binanggit cognitive behavioral approach. Although may behavioral, alam naman natin na CBT in a sense changes yung china-challenge ng CBT yung mga negative thoughts natin, inappropriate thoughts natin. So the clue word that you would be looking for is yung mga dysfunctional thoughts, kung paano siya babaguhin. And then letter C is reinforcement, mainly behavioral in a sense. D, helping the patient's family learn new ways of interacting with each other and with the patient. That's family therapy. Sa family therapy, nire-recognize na hindi lang yung patient yung may problema, pero yung system, yung interaction talaga. So for those who are studying the counseling psychotherapy, so family therapy is important to learn then. Then making sure that the patient has a lot of quiet time where she can be alone doesn't really fall sa cognitive behavioral approach na hinahanap natin. So letter A is the best answer because of the term dysfunctional thoughts, changing it. Next. Anxiety is thought to be, so this is just the difference between anxiety and fear. So anxiety is thought to be a future-oriented state, while fear is more immediate. So ang fear ay a response to an immediate threat. Anxiety is thinking of something na future-oriented that may or may not happen. Parang wala tayong evidence that it will happen. So we're just anxious of it. Next, agoraphobic avoidance behavior appears to be determined by, answer is B, the extent to which the person expects another panic attack to occur, specifically kapag nangyari siya sa certain situation. Agoraphobic kasi i-avoid mo yung situation, di ba? Kasi baka walang escape tapos nakaka-create ng panic symptoms. If nangyari siya through conditioning or behavioral approach, if nangyari siya for example sa market, agora means market. Nangyari siya sa market, nagkaroon ka ng panic attack sa market. So ngayon pag uwi mo, tas kailangan mo pa rin pumunta sa market, you would not go because you would expect na magpa-panic attack ka ulit doon sa specific place na yon because na-condition ka once and you do not want to experience it again. Parang napaprocess mo sa utak mo na the panic is a function of the place where you are in. So yan yung sa agoraphobic avoidance. So magsastay ka na lang sa bahay para hindi magkaroon ng panic attacks sa specific place, sa mga open spaces or enclosed spaces. As opposed to the panic disorder which happens anywhere, kahit nasa bahay. Kahit nasa safe space ka. 49. Which of the following is an accurate statement about panic disorder? So letter D, most individuals with panic will also avoid internal sensations that produce physiological arousal. So they are actually cognitive explanation ng panic disorder. They are hypersensitive to the physical sensation. Tapos ini-interpret nila to na may naramdaman ako, mag-i-escalate to. Kaya siya nag-i-escalate talaga. So as much as possible, they want to avoid that internal sensations because they would interpret it na mag-escalate sila soon. If not now, pero soon mag-escalate yun. And nandun yung fear na yun nga. Para kasing mamamatay ka, di ba, pag may panic attack. So they fear that. Okay, sabi dito, women are more likely than men to cope with panic disorder by drinking alcohol. Not true kasi by research, mas prevalent ang substance abuse sa mga lalaki. Okay, approximately 75% of those with agoraphobia are male. It's actually the female. An individual who suffers through an agoraphobic situation rather than avoiding is entirely not considered agoraphobic. Not because nagkaroon ka ng lakas ng loob na pumunta dun sa lugar, pero nag-occur naman yung panic attack. So that can still be a function of agoraphobia. But anyway, ang tinatanong dito is the panic disorder, which is separate na, di ba, sa DSM-5. Next, you are told about a child who has shown behavior consistent with separation anxiety. In order to determine if the child actually has a disorder or whether the behavior is normal, you would first need to know. Letter A is not important, yung gender. Letter B can be dahil sa biological predisposition. Letter D, because separation anxiety, I believe merong duration. But developmentally speaking, you have to consider the child's age. Ilang taon yung bata? Baka naman 2-3 years old na normal lang naman na maghabol sa magulang, yung mga ganong edad. So you will have to again consider the cultural, social background, developmental background ng mga clients natin before tayo magbigay ng diagnosis. Ayan. I think we can have a quick break before tayo mag-proceed dun sa other half of the question. Maybe a 10-minute break before tayo mag-proceed. Then, kung may question kayo, siguro sa end na lang ng additional questions, you can ask it at the end of nitong slides ng 100 questions. Okay, let's come back ng mga 2:15.